We have Leah Hirschfeld with us. Actually, I think she's going to come right back. I don't know if she's back yet. She is wonderful, and we usually welcome her about once a month. And oh, she's back, but she still has no camera. So I think we might be having her sound only. So Leah, are you there?
I am. Can you guys hear me?
We can hear you.
We have a lovely picture of Leah. We can use that.
That would be great.
There we go. So Leah, tell them a little bit about you and what you do at the Center for Autism and Related Disorders.
Of course. It's so weird not having my camera. I'm sorry about that. I don't know what's going on with my computer today. But yeah, so like Shannon said, I get to come on usually monthly, and it's just the most biggest pleasure of my month. And I am a research coordinator at the Center for Autism and Related Disorders. So what that means is I get to ask questions and answer those questions with data, and I get asked questions by families and patients and our clinicians. And then I generally run around trying to get them the best answers that science can provide. And then we try to give the best scientifically valid care that we can to our patients and the communities we serve. So it's quite a pleasure, and I really enjoy it. And then in the end of every month, I get to come on here and try to share my knowledge with everyone over here. So it's pretty great.
And can I just say how much I love what you do, because I don't know of any other ABA provider besides CARD that has a position like this, that, any one of the staff can come to you and say, what do we know about this? What does the research say about this? And they don't have to go run and do the legwork. You do it and help them interpret. And I also love that on a regular basis, you guys do share stories that are in the news with all of us that keep us up to date on what's happening. But not only, what's lovely, you guys, is that they put out a newsletter and they tell us about a research study, but then they condense it into ways that we can consume it. People that are working in this field, which is how we got to this, because we were like, well, we should be sharing that with the audience, right? And so this is our little slice of that newsletter. If you guys have questions about research, make sure that you're writing in, because Leah and the rest of the research team loves to come on and answer your questions about that. So Leah, we had to reschedule you from a couple of weeks ago. So remind me what the topic is that we're talking about this morning. I think
Absolutely.
I know, I'm pretty sure.
Yeah, of course. And I'll reiterate again, Shannon, what you said. Everyone, anytime I get to introduce myself and tell them who or what I work for or do, people are very confused, because you almost never see private research like this. So it's very, very special that CARD does it. And yes, I take questions from the audience. I usually don't answer them immediately on air, and I usually come back in a few weeks and answer. But please, please, please write in. You make my job easier, but also then I can make sure I'm giving you guys the information you want. So please write in any questions you have. And if anything's urgent or more urgent, you don't have to wait for the 4 weeks that is the turnaround of the show for when I come on. But you can always email Shannon or myself at research@centerforautism.com, autism-and-related-disorders.com. I always forget what the end of it, but I think it's the whole name of the organization. And you can always email us. We'll always answer. It might take a week, but we'll always get back to you with any questions. So we're always a resource for everyone who has anyone with autism. So, of course.
Muted.
Oop. And now I can't.
Now I'm here. Traven and I were both unmuting me at the same time, which double negative me out. So remind us what today's topic is. It's access to healthcare, right?
Yes, that's correct. So one of the questions that we received from I think a parent or a community member asked, do individuals with autism receive less quality healthcare or less access to healthcare? There's my picture. That's an older picture, but I love it. So we had a question about, do individuals with autism receive less quality healthcare or less access to healthcare? And the answer is yes to less access, and probably yes to less quality, unfortunately. And so today what we'll go through is I'll go through and I'll talk about a paper that came out this year. And this is what I typically try to do, and so does anyone else on my team. We'll come on. We usually try to pull a paper that came out in 2021, 2020, maybe 2019, so that it's the most up-to-date information. And then we'll kind of walk through what the researchers found, how to kind of parse all that information, some takeaways, and some action items that folks might be able to do. So this paper was published this year in 2021. It's by Malik Soni and colleagues, and it's about healthcare access barriers for individuals, and they go from diagnosis to adulthood. So they looked at folks from 0 all the way up to adulthood. And this one specifically was a literature review. And what that means is that the authors conducted an extensive search of currently published paper to determine what's going on. And I really love literature reviews because it means that instead of just looking at one paper, you're getting possibly a broader analysis and a broader look at the current literature. So anytime I try to come on, or anytime I try to make a point to anyone, I try to look for a literature review because I say, look, this is a decade's worth of research summed up here. There's also great single studies and things like that. But so these researchers included publications that were released by autism-focused non-governmental agencies. I include that here because a lot of the times literature reviews are by, you're only including peer-reviewed articles. And that means that those papers went through a very rigorous search and whole process. So the researchers would have sent in a paper, the journal sends that paper out to other people to review it. They ask a ton of questions. Those researchers get the question back. Then they resolve those questions, and then it finally gets published. That's a peer-reviewed paper. And that's usually what a literature review is. And also, that was included in this one, but then this group also included autism-focused non-governmental agencies. So there's a lot of information here. And they looked at everything post-2010. So it's the last decade's worth of research. And basically what they did was they looked at a bunch of barriers, and then they also looked at some age barriers, and then I'll talk about some so what and some takeaways. So first off, unfortunately, there is a shortage of healthcare services. So if you're a family that lives outside of a city, you're probably going to have less access to specialists and services. This unfortunately can lead to clinician burnout and long wait times for diagnosis and treatment. It also adds some additional challenges for the family. There can be challenges to get to the service center because there's long drive times and time commitments. There is this really cool tool. I haven't used it. And it's really long, so bear with me. It's called the Extension for Community Healthcare Outcomes, ECHO, Autism Screening Tool for Autism in Toddlers and Young Children STAT. That's the acronym. So I think this is called the ECHO STAT, but it's the whole name is Extension for Community Healthcare Outcomes, Autism Screening Tool for Autism in Toddlers and Young Children. That's a mouthful, but what this tool does is it aims to connect local physicians with autism experts to assist in screening, diagnosis, and treating individuals in non-urban areas. So if you're not getting the time you want, but you have a family doctor or a primary care physician who just doesn't necessarily have the expertise in autism, you might be able to go to them and say, listen, I heard about this tool. It's called the ECHO STAT. And it'll connect you and us to an autism expert to help with screening, diagnosing, and treating. I don't know what happens with insurance and things like that, but it's something at least to talk about and might give you an option if you're waiting for a very long time for a specialist. Transitioning over, you also have a problem, unfortunately.
Can we stop for just a second and go back over that? Because I think that's pretty important because so many people are having difficulty accessing assessments right now and getting diagnosis. So if they're having a hard time, where do they call?
So if they're having a hard time, again, this is called, I think you can just Google ECHO STAT, which is much easier than the Extension for Community Healthcare Outcomes, Autism Screening Tool for Autism in Toddlers and Young Children, which I am having a hard time not laughing at because it's very long. But if you Google that ECHO STAT, you can look into it. It should be able to connect local physicians. So if you have a family physician or a PCP, that you can go and take this tool and say, let's connect with them, let's call them, and they'll connect you to an autism expert to assist in screening, diagnosing, and treating individuals.
That's crazy great.
It's crazy great. I think there's still probably long wait times. I'm hoping there's not, but it's at least a tool to definitely check out.
Okay.
Leah, I have a question before you go further. When you say lack of access to medical services, is this also including ABA, for example, or would that not be considered a medical?
I don't know if that's what the researchers are including here, but I would say I would hazard a guess that yes, I think there is a severe lack of ABA services. Again, I mean, even if there's one in an hour drive around from your home, that's still, to me, a pretty severe lack if you have to drive an hour and an hour back each way. So I'm sure there's a lack of accessibility for that as well. Cool. Cool. Okay. Not cool. I always say cool, and it's most of the time when I come on, it's not cool. But the next thing to talk about is physician knowledge. So this kind of goes in hand with the shortage of healthcare services. So with physician knowledge, there's a lack of physician knowledge around autism, around managing care and supporting individuals. And most doctors will admit to that. A lot of medical students will say that they just don't have the training in dealing with and working with folks with autism, unfortunately. And what you might see a lot of is that some doctors will ascribe non-autism symptoms to a patient's autism. So what that might look like is you might bring your child in and say, little Johnny has GI problems. He's having tummy issues. And your doctor might say that that's because they have autism and move on. And if that happens, push back or try to find another doctor. I'll kind of touch on that in a little bit. But you can still address those problems even if your child has autism. You can go and say, no, we need to look for ways to solve his tummy issues. And they might do this too with sleep and other issues. One of the helpful things to explore here as well, when you find a lack of physician knowledge or before you go to a new doctor, or as a tool to help your child grow managing their own healthcare, is called Aspire's Autism Healthcare Accommodations Tool. So this is AASPIRE, Aspire's Autism Healthcare Accommodations Tool. That is much easier to say and remember. And that one, absolutely Google. They have a bunch of examples. And basically what it is it's a survey that helps an individual build a customized communication and sensory accommodation support builder that you can then give to the healthcare provider. So basically you can go do it for your child as your child gets older. You might be able to do it with them. And then as your child gets even older, this is something they could potentially do on their own, so that every time they go to a doctor, they may have a report that says, I can communicate in college level sentences, but I'm not necessarily understanding at that level. Or I am very sensitive to light. Or I'm very nervous about new procedures. Please, let's do a mock procedure before I have something done. And it gives a bunch of examples and a bunch of ideas and things like that. And it's very lovely and very well written. So you can work with your child together and you can go through the survey. And then it's a 2 or 3 page document for the doctor that you can have in their medical chart that says, these are the things to know about my child that will make this session with him better for everyone. So that is Aspire's Autism Healthcare Accommodations Tool, AASPIRE, Aspire's Autism Healthcare Accommodations Tool. I totally recommend everyone look at it. Just Google it really quickly. That is a quick, very easy tool to use. I checked it out myself beforehand. They have a bunch of mock PDF ones, and it's really neat. It gives a bunch of ideas of what you could say to your doctor as well, even if you don't print out and use the survey. 5 minutes, totally recommend, was very, very cool. I have other barriers, but I'll pause.
I'm just busy Googling these things so I can put up the links. It took me a while to find the EchoStat, but then I'm going to find the Aspire one. So you go right ahead, but that's what I'm doing.
Sounds good. Yeah, the EchoStat one I had a harder time with as well. Aspire's, the moment I put it in, I found it, and it was awesome with a bunch of PDFs. So I can definitely recommend the Aspires. Again, I looked through those PDFs, and there was really cool, great information. It was awesome and I like that it's a transition tool. So you can do it for your child as a toddler. You can do it with them in middle school, et cetera. And then when they go and transition to dealing with their own medical and healthcare, they can start filling out that survey for themselves and taking it and advocating for themselves. So I think that was awesome. Next, you have a few language barriers. Just as a heads up, multiple organizations have translated resources describing the signs of autism, steps to take when those signs are detected, and summarizing support. So if you're having any language barrier issues, you can always reach out to us here at a card on the research team, to Shannon. And generally, we probably could find something that's been translated, fortunately. Unfortunately, there's a lot of stigma around autism and having autism and going to the doctor. If that's something that you're dealing with or something you want to have a conversation with your child, I just found this out that the Sesame Workshop introduced a Muppet with autism. So that's Shannon's nodding. She's like, I know that. So that sounds really cool, and that might be something that where you can start to have a conversation as well.
We've actually had Julia, the woman who plays Julia, on the show.
Oh, that's so cool.
Yeah.
Believe me, I geeked out on it. I think Nancy did too.
Yeah. She was
and
fantastic.
she is, I'm sorry, Nancy, I interrupted you.
Oh, I just said she was fantastic.
And she's the mom of an individual on the spectrum.
Right.
Can we get that plug in too? Okay, so I just put links to Echo Autism and Aspire on, so that if you're watching live on Facebook, YouTube, or Twitter, those links are there right now for you. I also put the link to the Eric Garcia one because it was what I had posted before, but there you have it. You have the article, the New York Times article. Okay, Leah, go right ahead.
Thank you. And I've scrolled through down through the comments while you were talking, Shannon. Thank you for posting those links. And I saw a few questions as well. And those I can definitely talk about as we continue for sure.
Fabulous.
Awesome. So there's some age different barriers as well. So, when your child is 0 through 17, and this all kind of wraps up and touches on what we've already discussed, there's a limited expertise and capacity for ASD screening and diagnosis. And again, that goes back to that EchoStat tool that might be useful. There's a lack of awareness or insufficient insurance coverage for genetic screening following diagnosis. I won't get into that this time. I know we've talked about it on the show before, but that's something to think about. And there's a lack of clarity around referral pathways as well. As your kid transitions between the ages of 16 and 25, it transitions off to adulthood. Unfortunately, there's no or incomplete implementation of healthcare transition services. This is, I think, known as the services cliff, where at 21, services just kind of stop, which is a serious bummer. And there's a lack of clarity around the appropriate use of healthcare, especially for higher functioning individuals. And there's, again, suboptimal physician awareness of healthcare needs. And then once your child transitions up to adulthood and takes care of their medical needs potentially for themselves, there's communication difficulties between physicians and adults with ASD. And that's where, again, that Aspire tool might really be helpful for your child, where they can say, listen, this is a report. This is going to help explain who I am and what I need. There's a shortage of services or limited insurance to address mental health comorbidities, unfortunately. And again, there's another suboptimal awareness about the understanding of needs of aging adults with ASD. I talk all through this, and I have a bunch of so whats. I do have a bunch of like, what can we do? But I like to point out, as we go through this, a lot of the research that I come to and show on this show, I feel like a lot of the times it's, we already know this. I already know this. I have a child who's 2. I've already done this. I can't get him diagnosed, etc. But it's important that we're doing the research on this so that we can take this research. And when I say we, I don't just mean caregivers of individuals with autism or individuals with autism, but I mean CARD and everyone who advocates for individuals with autism, that we can take the research and say, listen, this is important. This is what the research has been found. And we need to put this into practice with our doctors, especially with our medical students. And I think that is where we're going. They have been doing studies with medical students about providing more compassionate care, about providing more care with individuals with autism. And this translates also over to, asking about pronouns and being more thoughtful about the differences that everyone has. So I do have a lot of hope about one day this getting a lot better. And this is the first step, this kind of literature review that says, listen, this is what we found. I have a bunch of ideas that Karen Nolte helped. She's their director of research and has incredible ideas. So if you ever have a problem, definitely send us a note, because we always get to consult with her and she's brilliant. As is honestly, everyone at CARD. They're just incredible people to work with. And so I'll go through that, but I'll pause really quickly before I go through all of that to say any questions.
Still muted. I see what one person has written in, and I think it's the song of so many people. They say, I need someone to mediate for me. I've been dealing with this alone, and every time I ask for help, I lack communication required, and I shut down. And I think what we've seen this across the board with adults that are on the spectrum that, but we also see it with the caregivers, Leah, that like somebody wants to get help for their child, but to do all of the steps to get through it, it's almost like somebody needs to provide a social worker or a caseworker or someone who can help you to jump through the hoops to get to the healthcare. So in all of this, what on your list would help with that?
I think, as I go through looking at my list, I think, and I will say, they're not social workers, but your ABA clinician, your behavior analyst, your BCBA may be able to help pinpoint how to connect all the ways of care and how to connect all the mediations. So I would highly, highly recommend you talk to your BCBA about that. Again, they're not social workers, they're not therapists in that kind of way, but they will say, I understand you are burnt out, or I understand that, doctor visits are something you really, really care about. And this is a big concern. And they will problem solve with you. And they will say, okay, how can we make sure you feel prepared? And that's where they will reach out to me and say, we need research that we can print out and I can give to this family. Or, I need research on how best to make sure that this dentist appointment is going to go well and not be a struggle, because dentist appointments are a struggle for everyone. But especially for children who have potentially sensitive sensitivities. And also those clinicians can say, I know another family at the center who has an amazing doctor, and I can recommend, we can get you in touch, and I can give you a recommendation, right? And that's one of the things on my list. So I would highly recommend, talk to your clinician. Please don't be afraid to talk to them and be very honest with them so that they can say, I can't help you. And, I can't give you a counseling session. That's not what we do, but I can recommend you to a therapist. I can recommend you to a doctor who specializes in this, and etc.
Leah, what if they don't have a BCBA? This might be, I think this was coming from an older individual too. What if they've aged out of working with a BCBA?
Can I just say, Nancy, that we have started something here in the state of California that will address this.
Okay.
We have with self-determination from regional centers in the state of California. What you have is that you have a caseworker who is assigned to you, who gets paid out of your money that you get to do all the things you want, who does exactly this, who is sort of a, I don't know what the word is, not a Gal Friday, but it's like your personal assistant who can mediate with doctors, who can help you fill out the paperwork, who makes sure that follows up with you, because everybody is different. So you just might need a reminder to do the paperwork, or you might need someone to help fill it out, right? But now with self-determination, people have a person that is assigned to them to help them. I hope that somebody does some research on that, Leah, to see if people get access to better healthcare as a result of that, and then have people fund that more.
Absolutely. I think we need it. There's so much coordination of care that it's absolutely required. So I hadn't heard about that for California. I'm glad we started it. Yeah. I really hope someone is following and tracking the progress on those individuals who are using that service, because I can only imagine that it will be a huge benefit.
So you got about 2 minutes, Leah. What else do you want to throw at us?
Yeah. So I would say, prepare before going to the doctor. Bring appropriate documents. Again, this is where you can go to the Aspire tool. This is where you can take the EchoStat and show it to your doctor. Keep all of your child's records and bring notes to appointments regarding what you want to cover. This also includes medications. If your child is taking medications, note what potential side effects might be happening. You can take data on that. You can say, watch your child and say, okay, I've noticed he keeps holding his head. He's been getting headaches more, etc. If you find that a doctor's not helpful, you do not have to stick with that doctor. You can look for a new one. Please continue to find your doctor until you find one that's supportive of your child and their needs. You can ask other parents. This is, again, where you could talk to, if you have an ABA provider, they might be able to help put you in touch with a doctor that all the families go to, or who someone had a really lovely experience with. And again, I'm trying to be very succinct right now, but now I'm just pausing.
Well, we put the pressure on you to finish fast. But
Um,
you got a lot of information here to cover.
my last really big takeaway that I think is really important is you just watch if you're looking for when you're looking for a doctor, trust your gut. If you feel like your doctor is not working for you, trust your gut. If you feel this doctor does not work for your child, trust your gut. If you are seeing your child take this medication and you're seeing the difference, but it's not the difference you want, trust your gut. You know your child well, and trust yourself. And if you need help, reach out to your behavior analyst if you have one. If you don't, reach out to us at CARD, at Research for Center for Autism and Related Disorders. We will try our best to provide the resources that we have. We will try our best to let you know if there aren't resources, which is also something then that we put on the back burner, and we say, listen, we've gotten 15 questions from parents about a coordinator of care, a person who coordinates care. Let's do research on that. Let's we'll loan out a researcher, and they'll do the coordination of care, and we'll see if that will work. So we take this information, and we distribute it, and we try our best to make sure we are providing the best care for everyone. So please reach out to us. Please trust your gut, and you guys know your children, and please, when you go to your doctor, just make sure that they address the cares you need them to address. And if they don't, get a new doctor until you find one that you like.
There we go. We're going to go over here for just a minute because I want to deal with some of the comments. Poker King wants to know if you know about 11q Jacobson syndrome. So maybe something to present to us on another day. Darren wrote into us about somebody that positions themselves supposedly as someone who can cure autism. We are not aware of that person or aware of those claims, Darren. So I'm going to choose not to comment on that, but to say to you, have no knowledge of that. And I think it's widely understood in the autism community that that language of somebody purporting to cure autism is not what is considered helpful to the community. So I would be very wary of people making those kinds of claims on a couple of different levels. It means that they're a little bit tone deaf to start, and to say that you can do that seems what's the word I want? Irresponsible. Is the word I think that I want. I also want to say to Badruddin, who wrote in and told us about a book that they've written about their son, I will definitely check it out. And the documentary that you told us about, I will definitely check that out as well. That's all in the comments. I do want to say to the person that we were talking to that, Nancy, you appropriately had the sense that this was an adult. They said, I'm 33 and I'm Australian. And while you don't have the benefit of the lovely California self-advocacy, I can tell you that in COVID, some of the advances that we have made are going to be helpful to people. If there's anybody that you know, whether it's a friend or a relative who can be of support to you when you go to the doctor, I know I have been on a video call with people in another state for a friend to be there to support and to help ask questions and to take notes for them to go over it afterward. And so if you have anyone in your life who can do that, ask your doctor. I think more people have more technology to be able to do that kind of thing, to help you, to advocate. I know just recently my son went for a checkup for the first time where he was he's 18 now, and he was going to drive the bus on it. And so we sat down and made a list of all the things that he was going to talk with the doctor about, and he had it on his phone. And, I think for everybody that's a good thing to do. But if you need somebody to help support you with the list, ask for friends and family. If somebody's willing to do that, they can do it long distance. And if nobody can, go to whatever your local support and ask, is there somebody who can help me with this? I bet you that there's somebody who would be willing to do that for you. Everybody needs that. That's not just people on the spectrum. They tell you if you're going to the doctor to talk about anything substantive, take somebody with you. If you can't, have them on Zoom. If all else fails, record the thing and take it to somebody afterwards and walk through it afterwards. Nancy, is there any, or Leah, or anything you want to share with any of that?
I'll throw in, you said you can use Zoom. That is true also about, one hopefully positive thing coming out of COVID is that telehealth and televisits are becoming much more regular. Most people are offering them, and your insurance companies are typically covering them. This is true for ABA services as well. So, definitely explore that option both with your doctors and with your behavior analysts if that's something that would work for you and your family. Absolutely.
Amen to that. Nancy, last thoughts?
I just want to thank Leah for coming on. We could talk
No
about
kidding.
this for another hour, but really illuminating. And thank you to all of our viewers for writing in.
Absolutely. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. To subscribe, click here. And if you'd like to check out some more of our videos, click here.